The U.S. needs at least 200,000 new registered nurses every year until 2030 to meet current demand.
I sit at my desk, staring at the computer screen, unable to shake the feeling that something is off. I have just looked at the latest employment projections from the Bureau of Labor Statistics, and the numbers are startling. According to the report, the registered nursing workforce is expected to grow 6% over the next decade. That means that the RN workforce will go from 3.1 million in 2021 to 3.3 million in 2031, an increase of 195,400 nurses. But the demand for nurses doesn't seem to be slowing down anytime soon.
I cried the whole way home in the Uber tonight, and the driver was like, "Ma'am, are you okay?" I was like, I don't think people understand how stressful this job is.
Imagine you're in the hospital, fighting for your life, and there aren't enough nurses to go around. The stress and fatigue of the nursing shortage would only add to your already overwhelming situation. That is the reality for too many patients and families as the nursing shortage crisis continues to deepen. But it's not just a problem for patients. Nurses are also feeling the strain, with many considering leaving the profession due to the overwhelming workload and lack of support. The nursing shortage is a crisis that impacts all of us, and it's time to do something about it. In this video, we'll explore the root causes of the nursing shortage and the potential solutions that could help alleviate the crisis and ensure that everyone gets the care they deserve. The nursing shortage in the United States is not a new problem. It has been a persistent issue for decades. In fact, the first recorded nursing shortage in the United States occurred during World War II, when many nurses left the profession to serve in the military. This shortage was followed by another in the 1960s, when the US experienced a surge in population growth and an increase in the demand for healthcare services. The nursing shortage persisted into the 1970s, as the US experienced a recession and a decrease in funding for nursing education. And the nursing shortage continued into the 1980s as the US faced a wave of hospital closures and a decrease in the number of nursing school graduates. In April 2022, Dr. David Auerbach and his team made a shocking discovery. According to their analysis published in Health Affairs, the nursing workforce had plummeted by an unprecedented 100,000 individuals since 2020. This is the greatest decrease observed over 40 years, and it's leaving healthcare providers to grapple with one of their most significant challenges yet: how to replenish this essential resource for patient care needs. But it gets even worse. Many of these nurses were under 35 years old and primarily worked at hospitals. This is a crisis that will have serious consequences for patients and the healthcare system as a whole. It's time to take action before it's too late.
As with the intensive care unit, documents from state regulators show an insufficient number of nurses. Two doctors told us they believe such staffing issues led to the unnecessary death of a man who came in with a headache, later diagnosed as an aneurysm. Unattended by nurses, he died before he could be operated on.
When we look at the notes, there was absolutely not a single nursing note for 12 hours. This should not happen.
According to a report by the American Association of Colleges of Nursing, U.S. nursing schools turned away 91,938 qualified applicants from baccalaureate and graduate nursing programs in 2021 due to a lack of faculty, clinical sites, classroom space, clinical preceptors, and budget constraints. That's right, 91,938 qualified individuals who wanted to become nurses were denied the opportunity to pursue their dreams because there weren't enough resources available. This is a major problem, and it is only going to get worse. This shortage of nursing school faculty is just the tip of the iceberg. According to a 2020 National Nursing Workforce Survey conducted by the National Council of State Boards of Nursing, the average age for an RN is 52 years old. This means that a significant portion of the nursing workforce is approaching retirement age, and we could be facing a wave of retirements in the next 15 years.
Nationwide, about 1 in 5 full-time registered nursing jobs are unfilled. Between the toll of the pandemic, retirements, and an aging population in need of more care, the shortage is only getting worse.
Dr. Peter Burhaus and his colleagues predict that more than 1 million registered nurses will retire from the workforce by 2030. But the nursing shortage isn't just about retirements. It's also about changing demographics. The U.S. Census Bureau reports that by 2034, there will be 77 million people aged 65 and older, compared to 76.5 million under the age of 18. This means that our population is aging, and there will be an increased need for geriatric care, including care for individuals with chronic diseases and comorbidities. This means that we need more nurses now than ever to care for our aging population. And what are some possible solutions to this problem?
Some hospitals are also increasing pay, offering bonuses, or helping to pay off student loans.
In this economy right now, the issues around cost of living are weighing heavily on our new nurse graduates in a way that I haven't seen in my 34 years.
A list of ideas that have been proposed or implemented to address this problem include increased funding for nursing education, offering incentives to attract more nurses to the profession, and improving working conditions for nurses. Nurses across the country have been gathering to improve their working conditions, limiting the number of patients they're allowed to care for, and increasing their annual wages.
And we are not going to stand by when this hospital puts profits over patient care. We are not going to stand by when they have ran this operation into the ground and now have 500 plus vacancies. It's utterly ridiculous.
National, state, and local governments could increase funding for nursing programs. This would open up the doors for schools to hire more nursing professors, and for these schools to accept more students into their programs. But what we should not do is discourage individuals from pursuing the nursing profession. The nursing shortage crisis is a ticking time bomb, and if we don't take action soon, it could have catastrophic consequences for patients and the healthcare system as a whole. Despite efforts to address the nursing shortage, the problem persists and is likely to continue unless more comprehensive and effective solutions are implemented. So what can we do about it? Let me know in the comment section below and subscribe to this channel if you want more content like this.